Hello, this is Dr. Conger with my continuing series on the effects of the shortened iliopsoas muscle on the human body. What I would like to talk about today is the cause of leg pain in people over 60 years of age. Many times you will hear that there's a hernia on the MRE, or that the person is diagnosed with a hernia above the age of 60, but that is not really possible due to the fact that above the age of 60, the nucleus pulposus, that is the jelly in the discus, is no longer present. You may see an old hernia on an MRE, but an active hernia above the age of 60 is not really possible due to the drying up of the jelly material in the disc. So many of these patients that are operated on at this age and older don't really have an successful operation or event because of the fact that it wasn't really a hernia on the nerve that was causing the pain. What we have found in our practice is that the cause of this pain is very often when the iliopsoas shortened becomes, it reduces of slows down the blood flow out of the leg. So what happens then is that the blood lives longer in the leg, and there's a corresponding drop in the pH levels in the leg, forming a sort of acid in the leg, and that acid begins to bite into the nerve in the leg and mimics a hernia. This is especially true in people that have a general low pH to begin with. Then with the additional closing down of the groin from the shortened iliopsoas, the pH drops even lower in the legs, and then what happens is that acid buildup happens in one or both legs, and this mimics the hernia, and that's why many operations for the hernia above the age of 60 aren't really successful, because it's an acid-induced nerve irritation and not really a pressure-induced irritation from a so-called herniated disc. We treat this very successfully in our practice, and we see many patients benefit from this new type of treatment. Thank you for your time, and I hope you look forward to seeing our series and continuing to follow us and also subscribing to our channel. Thank you very much.